My name is Mary Gomez. I'm the Vice President of Business Development for Epilepsy Alliance Florida, and I have the pleasure of welcoming you all today to the Power Up Your Safety Exploring Seizure Monitoring Devices webinar. I also have the honor of introducing our wonderful guest speaker, a dear friend and a colleague, Dr. Syndi Seinfeld. She's an esteemed expert in pediatric neurology and epilepsy care. Dr. Seinfeld is also a board member of Epilepsy Alliance Florida. She received her, I want to say this wrong, aren't I? Osteopathic medical degree from New York, right? Yeah. New York College, and has extensive in pediatrics, child neurology, and neuropsychology at Virginia Commonwealth University Hospital. She's board certified in both child neurology and epilepsy, has written manuscripts, reviews, book chapters. She's also, like I said, a wonderful board member for us. Her wealth of expertise is greatly appreciated. Dr. Seinfeld is dedicated to advancing epilepsy care and improving safety for individuals with epilepsy. With that said, Dr. Seinfeld, I hand it over to you.
Thank you, and thank you for that great introduction, and I appreciate the opportunity to give this lecture. What I'm going to talk about today is seizure monitoring devices. It is by no means a comprehensive, so there may be other types of monitoring devices out there, or you may have tried something different. This is just kind of an overview of the most common types and just the different thought process when you're choosing a seizure monitoring device. I do not have any disclosures related to this presentation. What the point of this presentation is, what I'd like everyone to get out of it is to understand what are the benefits of having a seizure monitoring device. So we know there are different types of devices. So we know there are a lot of factors to consider when choosing one. We want to talk about what the different types are and understand the limits of it. So that way we can make the best and most informed decisions. Before we talk about the devices, we have to talk a little bit about epilepsy because it's common. It affects around 50 million people worldwide. It's one of the most common neurological diseases globally. So estimated 5 million people are diagnosed with epilepsy each year. And this is from the World Health Organization from 2024. My favorite statistic is the one down on the bottom. The 1 in 26 people will develop epilepsy in their lifetime because it's a very common number. So I think that really gives you an idea of when you think about classrooms and friends and just groups, 1 in 26 people will have epilepsy. So it's a lot more epilepsy out there than people think. So we know that self-reporting of seizures can be unreliable for multiple reasons. So you may not know you had a seizure, especially if they happen at night. If your seizures are brief, if you live by, with children, which is a little bit different. Most of the time they're supervised, but it's impossible to watch someone 24/7. So we know that self-reporting and someone saying this is the number of seizures we're seeing is unreliable. We know that 86% of nocturnal seizures are not recognized or reported. That's a huge number. And I have the references of these different statistics within the slides. So we know that if we know about seizures and we know the frequency of seizures, we can intervene. We can make changes to a treatment plan, and this can help prevent the morbidity and mortality that's associated with epilepsy. So one of the scariest things I think associated with epilepsy is SUDEP, which is sudden unexpected death in epilepsy patients. It can occur at any time with any type of epilepsy. It is not a common occurrence. So it's very rare, and depending on your type of epilepsy, your seizure frequency, your diagnosis, those things all are factored in when we think about how frequent it could be. But part of the reason I bring it up is because when we look at seizure monitoring devices, part of the reason they've become so important is we want to decrease this risk as much as possible. And we know that if we can recognize seizures accurately, if we can treat seizures and know when they're happening, we can decrease this risk. So again, as I said, it's rare. It occurs approximately 1 in 1,000 adults with epilepsy every year. It's less common in children, so 1 in 4,500 children. And again, it talks about your etiology. If you have a genetic diagnosis as the cause of your epilepsy, if you have an injury as the cause of your epilepsy, all of those things can change it. How often you're having seizures, what type of seizures you're having. All seizures are not created equal. So someone who has just simple staring, that's much less concerning than someone who has bigger convulsive seizures. So these are just some handouts that are from the Child Neurology Foundation. There's all different handouts available online, all different resources. I know that Epilepsy Alliance Florida has different resources also, but I like this because it kind of just shows you the risk factors. So what makes your child high risk versus low risk. And I think that that can be important because you want everyone, if possible, to be in this low risk category. So you want to make these changes. And again, these are things like knowing when your child's having seizures, knowing when you're having seizures, making sure you're getting enough sleep. And sometimes it's difficult to do, especially if you're waking up because you're afraid you may have a seizure, or you're waking your child up because you're co-sleeping because you're not sure if your child's having seizures, taking medications. Those are just a few of the different things that we can modify to help decrease this risk. This is an article from a journal, and it was published back in 2021. And basically what it looked at was just the difference of these wearable devices. And we'll go through the different types of devices. So they have wearable devices, you have video devices, you have non-wearable devices, and the International League Against Epilepsy is kind of the governing body. When you look at our world of neurology, we have a group that help us make decisions and figure out the best care. And what this article did was it looked at using these devices and how it could be helpful. And what they found, let me go back, is that, wearable devices are recommended for people who have convulsive seizures. So those tonic-clonic, where you get stiff and then you shake. But again, it was weak. So it doesn't mean you have to have it. They just suggest it. They weren't able to say with this study the definitive risk of SUDEP goes down or your risk and morbidity and mortality go down. But they did find that there was some benefit and something that should be considered. The purposes of these devices are, it can tell someone else when you're having a seizure. So a monitor can notify someone else, and that can let them know you're having a seizure to provide care and medication. It can, again, also keep track of events. So that way someone who's having nocturnal seizures may be able to say, okay, I didn't realize I had a seizure last night, but I did have a seizure. But if you have an alarm that's triggered, then you can get assistance if there's someone else in that home. There are many different types of seizure detection devices. As I said, this is not going to be all-inclusive because there's just so many different types depending on where you live. Different countries have different availability. But there are some certain factors that you have to think about for all of them. So the first thing you have to think about is the detection device that you're considering going to pick up the type of seizures you have. So if you have staring seizures, you don't want something that's going to only pick up convulsive seizures. You want to make sure it's safety and it's suitable for your type of epilepsy. If you have episodes overnight, you want to make sure that you have something that's going to be okay to wear overnight that's not going to affect your sleep. How accurate is it going to be? Are you going to get false alarms? So seizures are scary. It's scary to get an alert, especially for parents, that your child's having a seizure. And certain of the devices will go off with certain stereotypic or rhythmic movements that are not seizure. So getting that device or getting an alert in the middle of the night that your child may be having a seizure when they're not, may be causing more panic and more harm to that child's sleep and your sleep. Will it be something that gets in way with your day-to-day living? Such as if you have a teenager who neurocognitively is age appropriate, having cameras in the room to pick up seizures may not be the best treatment choice because you want them to be independent. The cost of the monitor. So going through this, we'll talk a little bit about cost, but some of them require subscriptions and a lot of them have different extras that you can add. And what are the issues that you can experience? And those issues can be technical issues. They can be false alarms. They can even be so much as a side effect of it. So an alarm that gets put on your person, can it cause any injury to that person? You want to think about, is it something that you want to use outside the home? So a monitor that keeps you on video at night when you're sleeping or is it on your mattress pad is not going to help you if you're worried about having a seizure when you're not home. If the monitor goes off when you have a seizure but doesn't record it, then it may not be helpful if you live alone. And what type of monitor would you be comfortable using? And that's the question that should be talked about between the patient, the family, and the physician. Also, some of the devices, as we're going to talk about them, you can share that information with another provider. So it can be shared with either other family members, it can be shared with the doctor, it can record it on the cloud. So you want to make sure that if you don't want that to happen, that you're making sure you choose the device that doesn't do that. And look at the downside. So everything has a downside. So whether it's cost, whether it's false alarms, whether it's possible irritation, you want to consider it. The first broad group we're going to talk about is the most common one, which are the different apps that are available. So Inspire is an app. It can be put on either an Android device or an Apple device. It's something that's been well studied. It's been found to be used for 5 years and older. Some of that is because wearing that watch and the watch size may be restricting. In addition, it's also understanding to press the button to say, oh, this is a false alarm, or I was doing a movement that made it go off. You can do a free trial, which is interesting because then you can make sure this is something that would work for you if you already have a smartwatch. When you look here, it kind of goes through that you can use it without the phone, which is important because sometimes in certain settings, someone just asked, is the webinar delayed? That I don't know the answer to. So I don't know if anyone else on here knows if the webinar is on a time delay. I don't think so.
I don't believe so. Let me check.
But they are checking for anyone who's questioning, is there a time delay? This device can notify people. So it can send it to a notification. It gives you a secure access to your data, and it lets you set up reminders. And again, this is the website. There's a kind of a coupon code that you can use to get that first month for $1. And this is just more information about the Inspire. So these are things that are not going to tell you, yes, this is a seizure, or no, this is not a seizure. So you're using it to say this alarm's going off, and then you have to make that decision, is this a seizure or not? Just because it goes off, it doesn't tell you 100% it's a seizure. Some of the benefits with this type of app is that you have continuous monitoring. There's cloud-based storage. It can download reports. You can share it with your physician. Their customer service and support, although I cannot talk for that. I know that I've had other families that have felt that this has been very helpful. This was actually studied in an epilepsy monitoring unit. So it actually does have, has been found when studied to be beneficial to help recognize seizures. The seizure type that this is going to recognize are going to be those motor seizures. If your seizures are just staring or decreased awareness or confusion, this is not going to be a good app for you. There's different plans, and this kind of goes through, and this is what we were talking about in the beginning, is you have to think what you want out of it. So these are, you can kind of see, like with everything else, the cost goes up the more you get, depending on, what you feel is needed to keep you safe. So maybe that you don't need 2 contacts. It may be that you're not going to, want to have a snooze button. You're not going to report certain things. When you get to that highest level, you're getting the most technology. So it has your GPS location. It sends alert to multiple contacts. It collects your heart rate, audio. So it can do a lot. But again, you also have to be wearing it when you have the event. So you have to keep in mind, if you're not someone who's wearing the watch all the time, or if you have a child that you don't think will keep the watch on, it's not going to be beneficial. The next app is Seize Alarm. I like this because it's actually something you can download the free version on an Apple Watch. Of course, as you can see from this next slide, there are multiple different things that you can add on. So whether it's that, you manual requests for help, unlimited help requests, your GPS, all of these different things can be added on. But I think it's a very good gateway to trying it to see if you like the watch, or if you feel that you're going to have too many false alarms, or you're not really going to wear your watch. Hear from a lot of, especially my teens, that, they forget to charge it, or they're wearing it at night, so they don't, during the day they don't. So it's important that you figure out the best way to work this into your lifestyle. Another app is called EpiPal. So it helps detect seizures. So you have that seizure alert. It allows you to journal and kind of document what you're seeing. It allows you to track your medications, which may be something that's important, especially for some adults who feel like forgetting medications or medication adherence can be an issue. And then also creates kind of this family circle, which is giving you kind of support and notifications. They think it's the most comprehensive seizure detection available. So again, this is straight from their website. It does heart rate monitoring. It gives custom heart rate alerts. It's going to log the events. There's a button that you can press if you have an aura. And again, some of these things, if you have younger children, they're not going to be able to utilize these things. Or someone who doesn't have an aura, this wouldn't be helpful. And you can also put information regarding your seizure action plan. So seizure action plans are very important. I know Epilepsy Alliance Florida does a great job educating, and it's something that really any child or any adult with epilepsy should have a seizure action plan, not just the written down seizure action plan, but knowing, what is the next step. In a device like this, you can actually write it down. So it's not something just for a school, but you can have it to say, okay, something happens. This is the seizure action plan that we're going to take. So this is what should be followed to keep my child or myself safe. Okay. So those are just the different apps. So those can go on to just smartwatches that you would just get, and you can pay for them, not pay for them, however you feel comfortable. The next are wearable devices. So there's some overlap because the wearable devices include these watches. So we know that the watch is a wearable device, and you can put these apps on it. But we know that there's something called the Epi Monitor, which is an FDA cleared for adults and children 6 and up. And this is not like an app on a watch, but this is specifically made to detect seizures. So it has different adjustable sensing, so you can set it to be more specific or less specific. You can do a seizure diary. You can look for your trends. You can export your seizure diary. One of the things that they talk about is it has a 7-day battery life, which is excellent, right? If you have someone that's going to be sleeping in it and wearing it during the day, you don't want to have to charge it every day. It can detect, again, convulsive seizures. And again, it has all of this, but it doesn't look like a watch, so it's only for the seizure detection. This, because it's an FDA-cleared device, is going to need a prescription. It's online. It's something that any physician can do it, whether it's your neurologist, whether it's your primary care doctor. You're going to fill this out, and it gets uploaded by the family to the website, and then they reach out and we'll discuss the cost and if insurance will cover it. They also have a letter online, which I guess is a couple slides later, of how to, you can talk to your insurance company and say, this is, what my doctor recommends. This is medically necessary. I will tell you, I personally have never had an insurance company pay for it. You can use your health funds like your FSA, HSA to pay for it. There are some people who feel like they did get some of the money back when they submitted it. It has subscription plans. So this just goes through, you have a basic, a standard, and a plus. So similar to the apps, depending on what you feel you need out of it. So if you only have one caregiver you're sending it to versus multiple caregivers, if you need a location, if you need the manual alerts. So based on what you're looking for, you choose which plan is the best for you, but it is a monthly subscription in addition to purchasing the device itself. What's interesting for this one is that it also has a study because they're trying to figure out seizure forecasting. What seizure forecasting is, it's a way to predict when you're going to have seizures. So there's a lot of research going into this. And what they're trying to do is to be able to say, these are when your seizures happening. Can I predict the next time you're going to have a seizure? Right now, we are not able to accurately forecast when someone's having seizures, but the Epi Monitor is doing a study. So if you're interested in participating in the study, it's a way to get the device for less money and to help kind of minimize the costs. And they'll go through that in more detail with you, of course. But again, an option, thinking about what works best for you. This is the Night Watch, which is also considered a wearable device. It is not actually a watch. It goes on the arm, and what it does is it detects the muscles getting tight. You have the device right here that gets put on your arm. It detects the movement, and the heart rate's also detected. And then you have kind of that box that it gets sent to, and it'll detect mostly tonic-clonic seizures. So again, tonic-clonic, just stiff and shaking. If someone is just tonic, being stiff, hyperkinetic seizures, which just mean moving around a lot. So someone who has seizures, they may not be rhythmic movements, but they just get very agitated moving around. That can be picked up. And then myoclonic seizures, which are kind of brief, fast jerks of an extremity. So it picks up this type of, so again, someone who has an absence epilepsy or staring or confusional episodes, this is not going to be a good option for them. So, sorry, just to go back to this, but you also have to keep in mind that you have to be comfortable sleeping with it. So if you have a child or an adult who this disrupts their sleep or they can't keep it on, then you're not going to want to wear it. In addition, there's not been any reports of this causing skin breakdown or irritation, but you always have to worry about if something's on the skin like this. Can you get irritation from the skin, especially kids with sensitive skin? The Apple Watch. So we talked about different apps. Some of them were specifically Apple, some of them were Android and Apple. But the Apple Watch itself also has some seizure detection capability. So there's something called fall detection that's available on the Apple Watch, but it's something that you have to turn on. If you do have it on, it can alert emergency services. It can notify your emergency contact. If it has a hard fall, and if you've been immobile for a minute, it'll kind of move on your wrist, sound an alarm, and then attempt to call emergency services. It's only available with certain versions of the Apple Watch, but it's something that if you have an Apple Watch anyway, whether you have a seizure detection device or whether you feel like you need it, it's something free that you can add on to your daily routine to keep you safer. If you turn off wrist detection, that Apple Watch won't automatically attempt to call emergency service even after it detects a hard fall. So these are things, as not a huge Apple Watch user myself, these are settings that you need to look at to determine if you need to change them. To call emergency services, the watch needs to be near the iPhone and its cellular connection, or have Wi-Fi calling turned on. If it's not, if you don't have cellular, you don't have Wi-Fi, it can send a notification via satellite on certain versions. So this is actually, when you think about it, pretty interesting, because that gives us something to do on someone who's wearing this watch anyway for another reason. Because one of the big things that I hear with my patients, and I'm a pediatrician by training, and I follow pediatric patients, is that people don't want to feel different. So they don't want to have an app that's going to go off. They don't want to have, something that looks different that's not a smartwatch. This is something that what it's doing is letting you have your Apple Watch, which you're wearing anyway, but giving you some protection. But what you need to think about with this is that it's a hard fall. So not every seizure is associated with a hard fall to the ground. The definition of hard fall is a little bit ambiguous. Also, it delays it by a minute. So you have to be not moving for that minute, which when you think about seizures may be a long period of time, depending on what your seizure type is. Then there's something called the MFIT movement monitor. So what this is a pad that goes under the bed or under your mattress cover. It monitors you at night. It observes any movements. It alarms on the onset of repetitive muscle movements. But the nice thing is you're not paying a monthly fee. You purchase the device, and then you have the seizure detection device. You're not continually paying for it monthly. This is a picture of what it looks like. Instead, it just goes kind of, not right under the person, but under typically the sheets or the mattress cover. There can be an optional remote alarm, depending on how far apart the two rooms are. The nice thing is again, it gives this alert when it has a repetitive movement, which you'll typically see with either generalized tonic-clonic events, cluster of myoclonic events. You may see it with some of your hyperkinetic seizures. They have these different extras. So in the same way that the apps have different extras, this, even though it's one-time purchase, you can get the monitor, you can get the remote alarm, the different adapters. Then you have the SAMI, which I think is a great device especially for younger children. So this is a camera system. The nice thing about this camera system, though, is it's set to alert. When you look at your typical camera systems for younger children, you have to be looking at the video to see something happen. So it allows you to check on the child. But when you're sleeping, you're not going to be checking on the child. Whereas this allows an alert based on whatever movements or concern you have. So you have to position it. You want it 4 to 12 feet away from the child or the person being monitored. It can be from any angle. You have to choose a recording mode. So you can actually record this information to the cloud to go back and look at it, which may be a way to say, I want to see, am I missing some of my seizures? Can I see them? It can have customized to whatever alerts that you feel are best fit to rule out your seizures or capture your seizures. And again, it also has a live video audio feed. So it works that you don't have to have this and a child monitor. So the nice thing about this is that it's wearable free. So you're not worried about something being in a crib with the child or something that they can take off or something that they're going to play with. This is something that's outside of their sleeping area. It's appropriate for all ages, so you don't have a weight requirement like you do for the MFIT pad, because you have to have a certain amount of weight to shake it, to pick up the movement. You don't have to have, the wristwatch that fits. But you also want to keep in mind, even though it says appropriate for all ages, if you have an older child or an adult, videoing what's going on at night may not be appropriate. It can alert for both rhythmic, which is just kind of the same movements over and over again, and non-rhythmic movements. So any type of movement setting, which again helps with some of those hyperkinetic or some of those more subtle seizures. You can customize it and how long you want to have a movement before it alerts you. It triggers an alarm and displays the video and audio feed. And it works even in darkness. So you don't need to have a light on in the room just for the child or the adult. If you sleep in darkness, it'll still work. And it doesn't require an internet connection to function. So again, these kind of go through the costs of what the camera is and the different kits. This is a referral discount code. So we'll talk a little bit at the end about the different foundations that, can help with grants to pay for these. But Danny Did is one of them. And if you use this coupon code during checkout, you can get a reduced price. The app itself is free to download, and they give you the updates for free is one of the things that they do. I will tell you that this is probably one of the most common seizure detection programs in the pediatric world, because it allows you, again, to have the videos to look back to see and also to discuss it with your doctor. And since it's not within the crib or on the child, it allows you to not affect their sleep. A lot of kids will have both. So they'll have something like a SAMI maybe and an MFIT pad because they want to watch it, but they also want more rhythmic movements to be picked up. And that's okay. So just because you choose one doesn't mean you can't have another. These things can be used together. And the way to figure that out is to figure out what type of seizures you're looking for, what you want to do to address the seizures, and again, talk with your doctor to see what they feel would be best. So those are the big ones. You have your wearable ones, you have the apps, you have the non-wearable ones, but there are also some things that are out there that are not necessarily marketed just as seizure detection devices, but are other devices that we're using to detect seizures. So one is the Owlet BabySat. So this is something that requires a prescription. It's for kids 1 to 18 months of age. There's a weight. It's FDA cleared. It measures your O2, your pulse rate, your motion. It has a sensor in the sock. It alarms for critical levels. You can customize those. It's wire-free and adhesive-free, which is important because, again, you don't want wires in a crib with a child, and you don't want something that's adhesive because that can cause skin breakdown and irritation. It is only for Apple and iOS users, and it does need Wi-Fi to set it up. But they also have the Owlet Dream Sock, which is over the counter, which is something that I more commonly see families have, where it's just this kind of dream sock. It's FDA cleared to monitor pulse rate and heart rate changes. So it's not specifically detecting seizures. I've seen it both ways, that someone has the Owlet sock on and they're having all of these low heart rates or DSATs, and then someone comes into the hospital and these are not occurring. So it's related to the device. And it can also be missed. So if you're only having subtle changes, you may not capture it, but it gives you the peace of mind, especially in younger children. This is something called Snoozo Hero. This is a wearable on the diaper. So when you look at it here, this is kind of the picture. So what it's doing is it's picking up certain movements. You clip it onto the diaper. It's lightweight. You can hear movements with it. It's less expensive, but it's not something that's specifically meant for seizures. It does not require Wi-Fi or Bluetooth. But again, an option if it's something that you feel would work best for your child. I do have some concerns, again, about it coming off or irritation of the skin. There's something called the Masimo Rad 97. So this is a pulse ox. So you have to be careful with pulse oxes for seizure detection because you can actually get burns from the device and irritation from the adhesive material. But this is something that is created to try and overcome some of this. Something like this would really be more for a child or an adult who has significant respiratory concerns and is already followed by pulmonary, or those things are being addressed. but it's more accurate than buying something like an over-the-counter just pulse ox. So I've just given you all this information about numerous different types of seizure detection devices. So next I wanted to just talk a little bit about different resources because some people don't have the resources to pay these monthly fees or to buy these devices. How do you get access to them? And there's multiple different things that we can look out for. So one is the Danny Did Foundation. If you can go to their website, which is right here, and they actually have grant applications. And what this site is this Danny is, he passed away from SUDEP, but this foundation is to help provide these seizure detection devices to help decrease that risk of SUDEP that we talked about. You can either apply for the grant yourself, or Epilepsy Alliance Florida can help you with applying for them. And their website also goes through, I don't know if I have it the next slide. Nope. Their website also goes through the different devices. So I know I did a broad overview, but their website also has links to the different types of seizure detection devices so that you can go on and say, okay, well, this is what I was thinking about. Let me look at this website. How much would it cost? Is this something that they would cover? Then there's something called Josh Provides, and this is their information, their phone number. The Josh Provides, this is their mission statement to improve the quality of life of those living with epilepsy or other seizure disorders. You're applying for a grant to help get this seizure detection device. And again, you could either use Epilepsy Alliance Florida as a resource to apply for the grant or apply on your own. And then you have Epilepsy Alliance Florida, which you guys know about since you're listening to this webinar. So they have multiple different scholarships and just direction of where to go. So you have Josh Provides here, which is a financial assistance program, which I briefly mentioned. They have the Danny Did Foundation, which I mentioned. They have a lot of other resources. So when you have a child or an adult with epilepsy, depending on the type of epilepsy, it may be a foundation that you would apply to, like an LGS foundation, or it may be that they have Dravet syndrome, and you would use a Dravet syndrome foundation. In addition to these different scholarships for this, there's all different other types of things. So we didn't go into it in this talk, but it may be that you don't feel a seizure detection device is something you would use. You'd want a seizure dog. They have resources for that. And then, going to school, living your life, education-wise, they have a great place for all those different scholarships. So it's kind of overwhelming when you look at all the different options. And some of them look like, this is great. If I had this, I would always know if I had a seizure. But there are a lot of limitations to these devices. So the sensitivity and specificity varies. So that means sometimes it'll be a false alarm, sometimes it'll miss a real seizure. So what the goal is with any device that you're choosing is you want the one that's going to miss the least true seizures and have the least false alarms for things that are not seizure. And that could be difficult. And again, that's why your seizure type should be discussed, and you could talk about it with your doctor to figure out what would be best for you so you don't have that. For example, a child who has repetitive movements where they shake their hands like this because they like the way it feels, they're going to have their watch go off if they have a seizure detection, like an epi monitor. It's going to go off over and over and over again. So that wouldn't be something good to have because it adds a lot of anxiety for things that are not based in seizure. The different seizure types. So again, unfortunately, people who have seizures that are just brief episodes of staring, there really isn't a great seizure detection device. Those are people that typically need EEGs to say if we're missing seizures. But we also know that people who have those type of seizures are at risk for other seizure types. So it may be that something like an Apple Watch with those settings gives you that peace of mind. It may be that an app on your phone to make sure that you're not missing anything may make you feel better. Your age and independence. So we talked a little bit about this, but if you have a small child, again, giving them a watch, they're not going to be able to mark something or turn it off if something happens, is not as helpful as a teenager or an adult who's wearing a watch that can say, okay, I feel funny, I'm pressing the button, or, I did something and this is not a real seizure. So you can do that. So what you're looking for out of the device, or am I just worried about nighttime seizures? So if you're only worried about nighttime events, would the watch, sleeping with the watch, be something that you were comfortable doing? The expense. So we looked at, again, not full cost, but we know that there's a range. So depending on what works best for you, you also need to find within that device. So whether it's an app, whether it's a wearable, whether it's not a wearable, is this an expense that I can pay month to month? Do I feel like I need the highest level of this program, or do I feel like the basic one would be sufficient? And then the environment. So a child who has an alarm that's going to wake up their parents if they have a seizure, it's great. But if you live by yourself, something that just alarms when you have a seizure, but then goes off when the seizure stops, is not going to be as helpful. So you have to think about what environment you're using it in. If you have seizures mostly during the day, then a nighttime monitor may not be something that's helpful. So you want to think about what environment you're going to use it in. So just to kind of go over the final conclusions, there's a range of various seizure detection devices, but you have to choose what's best for you. So there's not a one fits all. It's really based on your seizure type, what you want to use it for, and what you feel comfortable using, and the cost factor. There are limitations. No matter what seizure device you choose, whether you have multiple or only one, you're not going to capture every seizure, and you're likely going to have false alarms. The person who's going to be the best able to answer these questions for each individual person is going to be the provider that follows you, because they know the most about your seizures, they know what they're looking for, and they're the ones you're going to discuss this information with. So if you come back and you have a journal of, these are my seizure frequency, this is my seizure pattern, they're the ones that are going to make those changes, so it's important to discuss it with them. And then these resources. So we know that not only are there resources to get devices at reduced costs, so some of these coupon codes, but you have Josh Provides, Danny Did, Epilepsy Alliance Florida. You want to make sure you're using those resources, because just buying something because it's the most expensive doesn't mean it's the best for that person. Questions. I want to leave a little bit more time because I feel like there are a lot of questions about different devices. I don't know if anyone has any questions or they want to type them in. I'm assuming the questions are going to show up in the chat if people have them.
They should show up in the chat. So maybe we'll give people just a minute to enter their question.
Not a problem. And I'm happy to answer questions. Again, I can't specifically answer, specific questions for you or your child, but I'm happy to kind of go an overview or answer any broader based questions. Okay, so the question is, are there any studies about the device effectiveness in detecting and protecting against SUDEP? So they have looked at it, but there are no prospective studies, so no studies that are ongoing that are looking at it. The general consensus is that devices should be helpful against SUDEP, and they recommend us looking into them, but there's no clear data or percentage. So we can't say, yes, having this device is going to protect you against SUDEP. And then have you ever heard of shareware? And I have not. So it's something that I would have to look into, which is, a great point, that if there's something that you've read or seen or heard about that you're thinking, you want to make sure you talk about it, because I'm always happy to look up. I don't know everything. I'm happy to look up different devices. We want to make sure that we're not doing any harm, but if something may be beneficial, I think it's always worth a discussion. How can you access this webinar information? My assumption is that Epilepsy Alliance Florida will have it. I think it's being recorded.
Yes, it's being recorded, and we will be putting this on YouTube, so you can go back and relive the whole webinar.
And again, I recommend, so I gave a brief overview of a lot of these different types, but go looking if there's something that interests you. So if you're really interested, and I can even go back. So if you're really interested in, say, it goes back slower, sorry, than I thought it was going to. So say you're really interested in the SAMI. Then what you want to do is you want to go to that website. So you don't want to say, okay, well, I've heard about the SAMI. That seems great. You want to take a look at their website to see, is this something that it would be appropriate for me to use? Is it something that I could, again, not just use at home, but if you travel a lot. So if you're traveling with someone and you need a seizure detection device that can go from place to place to place, is this something that can do that? Have you ever heard of Empatica? So yes, Empatica is actually the, I can go back to it. Is the Epi monitor. So Empatica is the older version of the Epi monitor. So this is their new device. So you need the new prescription. So the new prescription you get online is for the Epi monitor. It used to say Empatica. So this is the only FDA cleared wrist-worn device for epilepsy in the US. I think it is a good option for people who have motor seizures. Some of the downsides to it, in my opinion, are that it's not a smartwatch that you can say, oh, this is my smartwatch I'm using for other things. It's something that people would question, what are you wearing? So some of my teenagers really don't like to have someone know they have epilepsy. There's still a lot of concern. So if you feel like that would bring a question, you wouldn't want to use it, although people have Fitbits and everything else. The picture of it is here. It's not unattractive to wear. It looks like a watch. Again, it's just not a watch. But it does have the Epi monitor, or it used to be, again, Embrace, is helpful. And I do think that if you're looking and you have motor seizures and this is something that you're comfortable wearing, I do think the efficacy of this is well documented. The only thing that I feel is pretty equivalent is the Inspire app. Has been pretty well studied to detect seizures, and that data looks pretty good also. Although, again, it doesn't have that same FDA clearance. But I do think that it is a beneficial device. It can give you more independence because you can have it with you wherever you go. Some people don't mind sleeping in it. One of the things that is nice is that it also has that 7-day battery life, which is much longer than an iWatch or Android watch is going to give you. Those need to be charged much more frequently. And also, if you're interested in participating in research, the Epi monitor is going to give you that ability to participate in that forecasting study if it's something that you're interested in.
Dr. Seinfeld, there was a question in the chat. Does the Epi monitor have to be a certain distance from the base to work?
So it depends on what type of program you have. So when you go through the different types, so some of it, most of them need to be by a phone. So you have to have the iPhone with it for it to work. And when I say, there's no specific distance of it, it's just being with the phone. So you have to have an active phone for it to work and to notify people. Whereas some of the other apps do not require that. Yes, and the Inspire is compatible with the iWatch. So it works with iWatch and it works with Androids. And they have on their website, I can pull it up here. I wrote out just some of the different versions of the different watches. So Samsung, Google Pixel, the Fossil, it kind of goes through all the different devices. If you've never used one of these apps, you're not sure you're going to like it. I actually would say you want to do like a free day 30 trial of the Inspire before you commit to paying for it, is my opinion. Or you want to do something like, again, the Seize Alarm, which is you can download a free version of it to say, okay, I do like using an app on my watch. I want one that works a certain level or is much more specific. Other questions, thoughts, concerns?
We have another question in the chat. It says, how long does it take for the FDA to approve devices compared to AEDs?
So I will tell you that most devices are not going to go for an FDA approval, just because to spend the money to do those studies is not necessary when they know they're not being, covered by insurance regardless. when you look at that plus AEDs, it's a little bit different because the AEDs have multiple different phases of study and side effect profiles, whereas the devices are kind of, okay, I have this device, I'm putting it in for approval. But I will tell you, I don't picture the majority of them ever going in for FDA, just because, again, it doesn't change their selling power. And most of this is, right, these are, when you look at the cost, you're paying this much money to do it. And then you have this FDA clearance. And if insurance isn't going to pay for it, whether it's FDA cleared or not, it kind of it doesn't make sense for a lot of the companies to put that money into doing it. There are certain programs, some especially the bigger epilepsy programs and centers, will look at some of these different devices, which is how the Inspire actually was studied. And they actually said, okay, well, we're going to use this in our EMU to see how it works. And I think that those studies are actually going to be really effective, though I don't think they're ever going to be enough for FDA approval. Other questions? But of course, I don't know. I'm not part of the FDA, so I don't know what the changes to come would be, but I think it's less likely.
That is all the questions that we have in the chat. So I think that would probably wrap that up, Dr. Seinfeld.
Okay.
Awesome. Thank you so much. I think this is such an interesting topic, and I think it's one that a lot of people are talking about right now. So we're so excited that you came and to speak with us today. And we will be putting this on YouTube so that everybody can go back and access the information with Dr. Seinfeld speaking about everything. So we will have that up soon after this webinar is done.
Okay, excellent. Thank you. And again, if everyone, especially patients that follow here, I just encourage you guys to reach out to your provider if you have any specific questions about what would work best for you.
Awesome. Thank you so much. Have a great day, everybody.
Thank you.